Respected Ammaji, one of the most revered professors, Professor Madan Mohan, he has a yogic trait of friendliness, It must be a joy for the postgraduate students to have such a teacher. Otherwise, teachers tend to be strict. So he is showing what is called as Maitri, friendliness. That is the trait which yoga has to develop. And where is Anand? He had made a divine request. Now we have to understand where medicos are and where the spiritual world is. When the conference dates were announced, I had got a phone call from him. Dr. Naik, could you please book your tickets early? We were slightly low on the budget. You will be surprised what is spiritual in that. You imagine physicians conferences all over India. You imagine cardiology conferences all over India. They have been probably hijacked by the pharmaceuticals. There is tremendous pouring of funds, but the intent is not there. Registrations may be 10,000, but 5,000 physicians would be roaming out and looking about the city and whatever. So friends, in yoga you need to have the intent, sincere intent, and you need to work on it to progress. So this is for the first time in my life that I have received such a request. Otherwise the pharmaceuticals are ever willing, and it is the fifth aste, ahimsa, satya, asteya, brahmacharya, aparigraha. These are all the amas. Our morals have to be clean. They need not be told. If the world had followed brahmacharya, let's simply translate it as avoiding sex or not having multiple sex partners. The pandemic of HIV would not have killed millions. So that is the therapeutic potency of yoga. As physicians, everyone is struggling. My God, so many young patients are dying because of a sexually transmitted disease. What do? Everyone tried all the mechanisms to suppress the sex desire. Unfortunately, none was available. So ultimately, the medical fraternity switched over to safe sex practices. Avoid condoms, or rather use condoms. Use condoms. If you have one man, one woman, HIV won't have come at all, So, okay, this mental desire cannot be controlled. Use condoms. That will protect you. So, is this the way we protect? That is the medical approach, and yogic approach is different. But the first sutra of Patanjali Yoga Sutra says, Atha Yoganuशासनम. Yoga is a self-enforced discipline. I cannot force yogic practices on someone who is not willing. If I am a guru, a shishya, if he is there in front of me, he has to have a feeling of surrender. If he surrenders, then only a guru can guide him in that path. A guru should not force himself, and that is where friendliness and compassion, these traits are required. Otherwise, you become a strict teacher. You go in any classroom, you find that the teachers or the students behave only when the teacher is present. The moment the teacher runs away from the class, you find that there is chaos. So similarly, our mind produces several chaotic fluctuations, and they are called as chitta vritti, and they have to be restrained, but that is the end stage. Now, I come from Pune. B.K.S. Iyengar, Padmavibhushan he had received last February, 6 to 7 months before he died. He has been teaching yoga for several years, and I would mention one more point. In October 2006, in America, in San Francisco and in California, there is a declaration. They have celebrated it as an Iyengar Day there. Yes, that needs to be mentioned. And they had a unique way of celebrating. All his American students all over. See Guruji, the tree of yoga you have planted here 50 years back has grown so much. So tree was equated with Vrukshasana. All across US, there are 3 time zones, I think. Tree for 3 at 3, wherever his disciples were, on the street, in the office, on the roads, in the parks, wherever, they did Vrukshasana for 3 minutes on the right side and 3 minutes on the left side to show their respect for this revered person. It's the core of the body. We can't see it. We see it only in the X-rays or MRI. And his answer was simple: see this logic, vitarka, vichar, ananda, asmita, those reasoning, intense thinking and proper conclusions is a faculty which is necessary in the field of yoga. Now this is the anterior spinal region. We are focused only on a part, but you have to have an overview. He said, see what is parallel to the anterior spine? The anterior abdominal wall. So this deliberately I have shown a vertical section. So this is the anterior abdominal wall. So the anterior spine, anterior spinal region and the anterior spinal wall, they are parallel. When you bend forward, simple, you don't shrink your anterior abdominal wall. Why should there be a compression of the anterior spine? And this is genius, a masterpiece of an advice. So when you bend forward, the second answer and question was, when you are sitting, are you not bending forward? Sometimes as doctors, we tend to be stupid. We believe bending forward is only bringing the trunk down, but bringing the hips up also is a trunk bending, but this will never strike a doctor, because after grasping some knowledge, we start getting rigid in our views. And Amma, your observation is correct. Now I understand why you like working with children. They have an open mind. They are open to all knowledge. So, especially all the nascent medicos, those who are there here, I am happy that you are here. This subject will not be a burden on you. This will help you. It will help you make a better doctor, probably less corrupt doctor. It will help you. Cells will form tissues, and tissues will form organs. Organs with a common function will form systems, and a group of systems will make a whole individual. And the principle of physiology is, initially we are single cell zygote, but then it differentiates. So each cell contributes to the wholeness, and the whole contributes and helps each cell. So this principle you have to understand, and this is the basis of holistic health. Now Sankhya has also analyzed the human embodiment, and their analysis is in the form of principles. We have a never-changing principle which is the soul, all pervasive. And the other component is Prakriti. Prakriti Purusha Dvandva is what I have given. And what comes in Prakriti, all the three gunas, Sattva, Raja, Tama. Then the subtlemost part, which is the Chitta, is composed not only of the mind. As doctors, we tend to think that Chitta is the mind. Mind is the part which wavers and shows duality and all those things. There is ego. If I tell you do this, you tend to refuse. That is your ego. If I tell some yogic practitioner, or there was a discussion here, if you tell yogic practitioners, please come and listen and establish your science with this double blind, they will say, no, we don't believe. It is their ego which is speaking. Why shouldn't you allow your science to be tested? And the same ego is in allopathic practitioners also. Whatever has not stood the test of double-blind randomized trials will be discarded probably as trash. Now Patanjali gives an answer to the researchers of modern science. He says, Yoga Chitta Vritti Nirodha, and which is the first Chitta Vritti? Pramana. Pratyaksha Anumana Gama Pramanani. So Praman, evidence, is a disease which he has mentioned 5,000 years back. And now, sir, we are dealing with that problems. People are saying, is it evidence-based medicine or is it evidence-burdened medicine? So these are tools for progression. If you remain stuck up with a tool, then you cannot progress. So it is a progressive science till you reach the soul. Now, this is the functional unit, a cell. What is the requirement of a cell to survive, to function fully to its extent? One of the fear which everyone has is death, abhinivesha. So a cell dies, there are several cells, the neurons will die with us, but several cells have their cell size, they do their function and they die. So we are experiencing, I pray to this. But when you are standing on the Mother Earth, yes, she is supporting your burden. So don't feel bad. This is a part of Mother Earth. So this is Samastiti, musculoskeletal health. This is the art of standing. What happens is when we stand, we don't pay any attention to how we stand. Tadasana is samatvam yoga uchyate, balancing on the right and left, front and back, from the ankles, knees, hips, spine, all has to be in one line. That is samasthiti. Shoulders rolling back, sternum lifted. This is a seat of confidence. In elderly people you see, kyphosis comes, sternum sinks, there is depression, there is fear, and this leads to various disabilities. We have seen cognitive decline also is one of the part and parcels of aging. Can you avoid it? This is an anti-aging posture. In addition to cognitive decline in the elderly, when you bend, what happens is this sinks and there is fear. You will see elderly, they don't walk with their leg, they seek support. So you have to be firm and established on your feet. This is Utthita Hasta Padasana, Parshva Hasta Padasana, and let me show Trikonasana. Now certain differences I will make a mention, that there is no muscular contraction in any of the yogic postures. Virabhadrasana, 2 followed by Parshva Konasana. So this is a square, and the quadriceps and the hamstrings are gripping my femur and they are extending. I have the tape, but unfortunately we don't have the time. So you see that muscles don't shorten. Shortening of muscles is a disease. This is Parshva Konasana. Now see, I am extending from the little toe to the little finger, a single stretch, ekatanada dhyanam. So asanas are dhyana also. Then you have Virabhadrasana 1. You work on all the joints, all the musculoskeletal aspects, musculoskeletal structures for developing them. Now what is the physiology of muscle, microscopic physiology? Short muscles work. Are there any medicos, physio students? Muscles work better when they are short or when they are long? Physiology students.
You're asking a question.
Oh my God.
I don't know your answers.
That's Starling's law. The greater is the force of contraction. So shortened muscles are disease, and with aging the physiology which changes to pathology results in shortening of the muscles. So short muscles cannot contract effectively. So if you require muscular strength also, you have to have lengthening of the muscles. In all isometric exercise, what happens is you shorten your muscles, and you see bodybuilders, their posture changes with whatever you do. Now in Trikonasana, if you see, there is stretching of the back muscles and front muscles. There is no contraction anywhere. And then you go to Ardha Chandrasana. This is stretching of the calf muscles, stretching of the hamstrings. Nowhere is there any contraction. So you have to understand that contraction is not a part of yogic practice. Sthira Sukham Asanam. Perverse interpretation is, don't exert yourself. You should be comfortable in whatever you do. Now, how do you study physiology yourself? Stay for some time till you bear that pain. Pain is a part and parcel of you. One hand remains straight, and the part which is remaining, you palpate that deltoid there. Deltoid. See, this is the deltoid. Palpate the deltoid. How is it? That is showing, you talk in physiologic terms. That is isometric contraction, not allowed. But then you feel weight. Honor, dishonor, pain, pleasure. So asanas take you beyond the disability. Now, some of the therapeutic mechanisms, this brilliance is found only with Guruji. So, principles of symmetry, samatvam yoga uchyate, yoga karma su kaushalam. Just doing this is anyway. You understand this, you rectify this, and then you proceed towards equal feeling bhavana. Japa has to have artha and bhavana. So on both sides, then you are progressing. Sir, can you just take your hands up? Now, can you see from front? No. See this hand. Shoulder, elbow, that is the study which you have to do, and the wrist. And here you see where the shoulder is, where the elbow is, where the wrist is. So which hand is aligned? Right one. So right is healthy. Left is diseased, because this is a part which goes into an asana is a healthy part. So you have a duality within you, physiology and pathology. This is physiology, this is pathology. Guruji used to say, you have a guru within you and you have a shishya within you. So this is the guru. Now, how are the tissues placed here is what your mind, your somatosensory cortex has to perceive. Somatosensory parietal cortex is concerned with body awareness, somatognosis, that is our medical term. So, this you have to catch. Another example, if you want to see, the medical answer is simple. We know everything. This is right-handed dominance, left-handed dominance. So, you just try the Hasta Mudra of Gomukhasana. If you want, you can try and see the different distance between wherever you may be. So, this is the earlier, see the distance. You will feel the difference yourself. It doesn't matter, you are not going to hold. It doesn't matter if you can't hold, see where the touch is. Wait. So, she is holding almost right up to the wrist. Now do on the other side. You see the difference? So, the difference is not as a result of right-handed dominance, left-handed dominance. That is our medical explanation. This is an early form of somatic disease. See, when you have a frozen shoulder, but whatever is invisible, we can't catch. So, yoga tells you, asana tells you to do what is not available. Now, Virabhadrasana 3. So, this is working on the peripheral limb muscles. Now, medically you understand how are the muscles placed. Yoga action is traction, it is stretching the muscles. All these are straight muscles, biceps, then your quadriceps, hamstrings, your gastrocnemius, your soleus, they are straight. Which muscle is this? Backbenchers. The Trikonasana. This is the gluteus, this is the latissimus dorsi, you have various supraspinatus, infraspinatus, all muscles. There is no contraction anywhere. An intensive form of above is Parivritta Parshvakonasana. So you have to work on more than 200 joints. So can you see that? See this. Now when you are practicing, you realize I can do it, and it is freeing this zone. When you stretch, an ordinary person calls it as stretch. But in yogic terms, it is working on the Akash Tattva. So that is what gives you the relief. When you stretch something, you give space. And when space is given, what flows is the prana, the life force which we have no medical tools to catch. And when prana shakti flows there a patient feels relief. You don't burden him with all these theoretical details. A patient has come with suffering, you give him relief. That's your job. Parshvottanasana. So now, a yogic, this is good for shoulders, shoulder blades. But when someone comes, you've seen all. This is how you welcome your guest. Welcome your revered person. Now, for a yogi, the most revered person is the soul. And in yogic sciences, Hridaya Chitta Samvite, heart is the seat of the soul. So this is a yogi's way of praying the soul in front.
Let's say goodbye.
And yes, Parshvottanasana, he is praying to the soul. But the effect, we may analyze that it works on your forearm muscles for the frozen shoulder, for the spondylitis. You can't tell a patient you have come for suffering, you practice yoga for reaching the Lord. Why do you want to say that? And this is Parshva. Parshva is the flanks. Why do you want to work on the flanks? So the body placement is such that there is no contraction, or there should be no contraction of muscle anywhere. Uttanasana, this is therapeutic for the backache. Gayatri, you have a tape. Prasarita Pad and Uttanasana. And then you see Uttanasana is intense stretch of the spine. Experiment what happens. Let me see the observation of physiology students. According to yogic sciences, this is Padangushtasana. If I am hanging, then there may be some contraction. But if I hold my big toe and fix my thighs without shortening them and pull my abdomen and navel down, you are working on the navel chakra. There is no contraction. You remember that first slide. From symphysis pubis to the xiphisternum is the anterior abdominal. If you go this way, you are compressing the anterior spine, and that will injure yourself. So this is making the abdomen long. Lambodharam is a term used for Ganesha. Lambodhara is not pot-bellied. Otherwise, majority of the school children are believed to be. Lambodhara is long abdominal muscles. So recti also have to be long. So you use your recti long. You are making the spine long, and then go with that length. There will be no pain. If you do Padhastasana, I am shortening or lengthening my muscles also. And then I do Uttanasana, intense stretch of the spine. Anand, can you just come here? 0 to You see that? Yeah, or this, see, vertebra. When you are standing on the legs, see, quadrupeds, if you see, they have hind limbs and forelimbs are of equal power. But in humans, we assume a plantigrade posture. Our leg muscles, bones, everything is stronger because of action of Prithvi Tattva, gravity. You use the same gravity and you work on the hand muscles. So you make your arm bones long, arm muscles have to grip the bones and make them long. So Adho Mukha Svanasana, Chaturanga Dandasana, Urdhva Mukha Svanasana, where you are working on the hands. If you just contract your muscles, they remain contracted and your posture changes. So that should not happen. Yogic actions are different, you understand that way. Conquest of Tattva, the aim of asana is to conquer the Prakriti, which consists of Panchamavata, Prithvi, Ap, Tej, Vayu, Akash, Pancha Tanmadra, Shabda, Sparsha, Rasa, Rupa, Gandha. Then Pancha Jnanendriyas, the all sense organs, Pancha Karmendriyas, 2 arms, 2 limbs, the organ of speech, the genital and the excretory organ, and then the Chitta. The journey begins with the musculoskeletal body. You have to make it strong and use it for further pursuits, not for enjoyment. If you use a strong body for enjoyment, it is called as Bhogartha Sadhana. If you use it for further pursuits, it is Apavargartha Sadhana. How it functions on the Apana. Now you see the pelvic cavity. This is the false pelvis, and you see there, can you see the widening? Can your eyes catch it? This is Baddha Konasana. This is a restless mind. You have to have a sustained actions and lengthen the adductors, and you see the widening of the pelvic cavity. Now adductor tears are very common in athletes because they don't do it. This is a sports physiology. With aging, what happens is apana, your vital life force goes down. So women after 40 or 50, they decide whether to go or not by their bladder capacity, which comes down. 3 hours, no toilet, I won't go. That is what the mind, because the apana doesn't function. It is the loss of life function, which muscular activity will not help you. So these are a boon for females because this functions in apana. And plus you have to have a lift. So that is where the organic action begins. With 40 plus in the pelvic floor gives you have uterine prolapse, bladder prolapse, so many things. Why subject yourself to hysterectomy? Why not avoid it by doing asana practice? So from musculoskeletal strength, we are going to organic exercise. The musculoskeletal body, which is strength. So from first MBBS, you go to a second MBBS. Directly, you should never have a bypass. Don't try shortcut. Janu Shirshasana. Janu is the Shirsha. You may see stretching of your back. So action is on the back, but the organic action is rotating the intestines, placing the intestines on the thigh, and compressing and massaging. Now this term is unknown. Have you been to any hospital and see what the sister does? You go in the ward. They will rub the skin, tap it, squeeze it, churn it and increase the blood supply, and then easily that IV is set in. So compression, churning, squeezing, massaging is a way, yogic way of increasing the blood supply to your abdominal organs. They are, can I have that? Paschimottanasana. Then you have Paschimottanasana. Paschima is the west, posterior. From the back of the heel to here, this is all extended. Paschimottanasana. This is therapeutic for back pain and back relief. Upavishana as Brahmacharyasana. If someone comes to you, sir, and says, sir, I have intense sexual desire, how to regulate it? What will we do? As medicos, we have Viagra, which is again a multi-million-dollar industry. But if someone comes earnestly with an intent, I have to control my sexual urge, I cannot, we will be helpless probably. So Brahmacharyasana, it is also called as Brahmacharyasana. So it will help you towards that. Upavishta Konasana. So these are known for pregnancy and in women, so they have to do. Now some of these strange terminologies. See, this is flexion, extension, abduction, adduction. This is circumduction. Only the front benches are answering. So, see, this is liver, flexion, extension. Now, this is parivritta, is circumduction. These are Guru's, they are not my term. And there is no medical equivalent, So, this is circumduction of the liver. Parivritta Janu Shirshasana. So, you are working on vital spaces inside. You are generating space. Abdomen is a closed cavity. You generate space. If space is created, suction is created, and that suction draws in blood inside. So, if you have compression working, pratyahar is a part of fifth limb. So, pratyahar Lord Krishna has described by which creature? Tortoise, yeah. So, this is the physical equivalent. I don't know if I can show here.
Watch out, follow me.
Oh. So, or probably I'll try here and just see if you can see. So, circumduction, stretching, lengthening of so-called hip and this thing ligaments. This is Durvasasana. The king of asanas is Shirshasana. See, the yogi reveres his brain. Brain is the seat of intelligence, brain is the seat of Brahmana, brain is the seat of pituitary, brain is the seat of reasoning. So all that is given proper blood supply without any potential for injuring. So you have prepared, acclimatized yourself with your previous practices. Now any music is called as Nada Sadhana. So even Asana Sadhana is Nada Sadhana. You have to realize that internal Nada within, from legs to the spine is Aroha, but in inversions you are doing Avroha. So this is working on the spine, Parshva Shirshasana. Now I am working on my spine. What happens is, with aging you develop osteoporosis of the kyphosis or of the dorsal spine, and you develop kyphosis. Then Parivritta Ekapad Shirshasana. So this is, my limbs are used to strengthen my spine, and anterior to the spine are the chakras. Ekapad Shirshasana. Parshva Ekapad Shirshasana. Now this is working principally from the sacral, lumbar, you go lower down. The gravity, center of gravity sinks to the dorsal spine, and you are working on the dorsal spine. Parshva Padmasana Yukta Sarvangasana. So right and left side, not only of the body, you develop, and before availability of sonography, any other activity, this is Pindasana, extreme flexion pose or fetus pose. So this is the king of asanas. Versions work on the pulmonary circulation. It's a gravity dependent circulation. So you get all the bronchovascular segments which are perfused as well as given air, aerated and ventilated. So this is Sarvangasana, Halasana, Sarvangasana. Now this you have to know. This functions on the endocrine. This is the thyroid. How do you increase the endocrine? I can't massage my thyroid this way. This is strangulation. So Jalandhar one lengthens the neck muscles as well as gives you thyroid health. we don't have thyroid hormone sensitive enough to know what the changes are. So this tells you Jalar Bandhu, Sarvangasana, Setu 1 Sarvangasana. Now can you see the anterior spinal region? Now this works a last model and then we'll stop. This works, this is a yogic way of cardiac massage, how it functions for the heart. Anand? And medically, all of you know, we will kneel down here and we have to compress the heart manually between the sternum and the vertebral column. 6 centimeters your sternum has to be depressed. It's a poor delicate bone, though it is the seat of the soul. And you compress it with vigorous compressions, mouth to mouth. Some patients may come out. So this is medically called as cardiac massage. So you massage a BP apparatus, the bulb of a sphygmomanoid between your hands. So here you are compressing the heart between your sternum and the vertebral column. Sternum is compressed, and what are the side effects? Patients will live, of course, some may survive, but others, those who survive, may have rib fractures, pneumothorax, pneumonia. That is something which we have to accept. Yogic way is we stand on our heads, but we stand on our feet rather. Yogis stand on their heads. So this is a way of giving cardiac massage. Enough. So what a yogi does is he massages in a same way, non-injurious way. So a dorsal spine is used to push the heart forward so that it is compressed against the sternum, a non-injurious way. Just a last pose for me. Yeah, that's. So dorsal spine is used to compress the heart and open it further. This is again a form of cardiac massage. This should be called as cardio, not simple walking. Walking is actually musculoskeletal exercise. It's got nothing to do with the heart. So dorsal spine, I have to push in so much so that my heart exerts. So these are in a patient is quite difficult. There are certain figures, but I think we have short the time. We stop here. Thanks for a patient listening.